Ladies and gentlemen, please welcome Ambassador Sherry Rehman of Pakistan.
Good morning, and thank you for inviting me here to this important conference, and we are very happy from Pakistan to be contributing and committing our country's statement at this important meeting today. So here we are for the Child Survival Call to Action, and hope that we are able to join hands and take all our countries and groups together in proactive commitment and implementation to this important call to action. So, ladies and gentlemen, no country ignores its children, women, and vulnerable communities can boast of a plural, inclusive identity. Democratic Pakistan is working towards that goal, as you know, and for us that is a primary and important commitment. You also know that Pakistan is one of the world's most populous countries. It is also one of the world's youngest populations, and in fact, more than a third of the population is 14 years old or younger. This large cohort of children poses both an opportunity and a challenge. But I'm not here to mouth cliches. I want to state very unequivocally that health is indeed an extremely high priority for Pakistan's democratically elected government. The Pakistan's People's Party has always run a flagship health program that stays ahead of the curve on all pro-people and pro-poor agendas. There are, however, and unfortunately, still 400,000 preventable deaths among children under 5 years of age in Pakistan. That is a big number, and that is not a number that we can live with or shall continue to live with. And of course, we seek your partnership and support in changing that dynamic. Realizing the urgent need for concrete action to change this very chilling statistic, various stakeholders in Pakistan have unanimously agreed to join hands with global partners to fulfill what we call a promise to keep. This is a multi-year program to monitor and strengthen progress towards the goal of ending preventable child deaths. The program includes major national initiatives to integrate maternal, newborn, and child health, MNCH, at the policy and programmatic level at both the federal and provincial tier. It also includes development of critical human resources, such as upscaling the number and quality of community midwives and health workers, as well as establishing an integrated framework for MNCH and nutrition services. Post our devolution, particularly in some provinces where the challenge is quite great now, to build synergies and for sustainable and substantive impact. And here I want to just flag that while we have fulfilled a very old promise to our country and to our people to devolve government to the provincial tier, this has been, this great shift from the federal to the provincial level has posed challenges for health governance and for many other sectors that we seek to build in a more, I would say, integrated and synergistic framework, which will take some time and support. I want to add that newborn survival, we feel, is the key to decreasing child mortality. Therefore, we are focusing primarily on high-impact newborn interventions. Our prime objective here is to ensure access and availability of trained and equipped frontline lady health workers at the community level for every mother, every newborn, and every child in Pakistan. We understand that this would entail ramping up the numbers of our lady health workers as well as community midwives to deliver equitable primary and reproductive healthcare services at the doorstep for mothers and children. Additionally, community case management of common childhood illnesses will be incorporated as an integral component of existing community health delivery programs. We also know and acknowledge that Pakistan faces huge challenges of economic fragility and complex traditional and human security issues, amplified, as you all may well know, by natural disasters, especially over the last 5 years. And personally, I feel very strongly about working with the international community because just before coming here to this position, I was chair of the Red Crescent, International Red Crescent in Pakistan, and our workers and aid colleagues face challenges on the ground, as well as brought on structural changes, as well as those brought on by the natural disasters we have cyclically been facing one after another. And despite these challenges and those posed by the devolution of health to the provinces as a sector, as well as shrinking fiscal space for social sector, Pakistan has undertaken several large-scale initiatives to reach the poor and marginalized at the bottom of our pyramid. Of these multiple initiatives, the government's flagship Lady Health Workers program remains a key strategy and intervention for delivering care to rural and marginalized populations. The late Prime Minister Benazir Bhutto launched this program in 1994, and I take pause to mention her because this was a program that she personally drove, and I was also health minister about 2 years ago in this very government when we were a federal health ministry as well. And this program became, and it still is called, an international gold standard for community healthcare. And we hope that we can add substantial increments to make her dream and ours a reality of reaching every woman and every child at the doorstep. The program aims to provide community-based preventive services through local engagement and education. The 110,000 lady health workers in Pakistan fan out over 70% of the rural population and provide key services related to antenatal care, breastfeeding, promotion, immunizations, which include oral polio vaccines, and the treatment of common illnesses, as well as providing advice and the staples of primary health care. This is very important to our community intervention program, and you already must have heard that we've been faced with critical challenges in the polio and other immunization programs, other than, of course, the increasing capacity and technical coordination, as well as protecting cold chains and workers. There has been a significant political issue related to the conflict, especially in the northern parts of our country, that vaccinators tend to face. And we feel very strongly that we need to protect all aid workers, vaccinators, and community activists from the kind of extremist and conflict agendas that can impact these kind of critical actions on the ground. However, despite limitations, I'm happy to tell you that the Lady Health Worker program in Pakistan has still been at the forefront in developing pilot interventions and shaping more and more global policies and sharing best practices. These include improved strategies for linking communities to the formal health system, addressing major killers such as diarrhea and pneumonia, and the prevention of maternal and newborn infections. Pakistan has also witnessed major civil society initiatives, including public-private partnerships, emergency transport schemes, M-Health initiatives, and financial support schemes. We welcome those, and we hope that we can provide robust support for all players and actors in the healthcare field, and some of us, our practitioners, are with us this afternoon. I can see them in the audience, so welcome all Pakistanis to Washington, D.C. I hope to see you before you leave. I'm sorry, I'm the ambassador. I had to throw that in. And before I stand too long between you and your lunch, I'd just like to inform the House that Pakistan has also built in one of the largest not just healthcare, but social sector delivery programs. Our Benazir Income Support Program, for the first time in the history of Pakistan, targets over 40% of the population below the poverty line and offers major opportunities for families to promote MNCH in the future. And, this is the first healthcare net introduced in Pakistan at the government level. As I said, it is a signature outreach of this government. And we had identified from day one and dot zero that these programs, these transfer credits to women, that these programs, unrelated at that point to health, and we are building in health initiatives, we are building in other initiatives into this that empower women. No householder can reach this program or take its benefits if the woman of the household is not encashing it. So it directly speaks to women, it empowers them, it makes them earners of their own income, no matter how small it is, and it gives them a voice not just in the community, but in the household where they do need to be, I would think, substantially empowered. The key challenge Pakistan faces today lies in implementation, literally. And there is, of course, a strong emphasis on monitoring and evaluation, and, of course, enhancing and improving program performance. But accountability also plays a key part in closing that cycle of optimal enhancements and, of course, performance indicators. The government of Pakistan and the Pakistan delegation that represents all sectors of the community, I'm sure, commits itself firmly to reaching the Millennium Development Goals for maternal and child health, and to also undertake a national level countdown so that we understand the disparities, the gaps, and look towards identifying solutions in time. We would further like to pledge that the recent health reforms with increased provincial autonomy will be capitalized as an opportunity to scale up the low-cost and low-tech evidence-based best practices for MNCH and FP. Our aim is to strengthen the healthcare delivery system by adapting effective public-private partnerships models at scale. And in this endeavor, I'm very pleased to say that Pakistan has had the support of a broad range of international partners, and I take the opportunity to say that and point out that DFID, USAID, and Australian AID are working closely and proactively with the government of Pakistan to prevent approximately 195,000 under-5 child deaths over a period of 3 years through an investment of $485 million. So thank you for that, and keep coming at us with all your questions and your exasperations. Let us join hands together at this point, ladies and gentlemen, to realize our shared vision of a Pakistan where no mother, no newborn or child dies due to preventable causes, and where all children live to achieve their full potential. I would like, before I close, to reiterate the vision statement of my friend, mentor, and leader, Mohtarama Benazir Bhutto, the former Prime Minister of Pakistan, who said very presciently and often, "I dream of a Pakistan, an Asia, of a world where every pregnancy is planned and every child conceived is nurtured, loved, educated, and supported." So I thank you, and I look forward to seeing you briefly at lunch. Thank you very much.